What's going on, podcast listeners? This is Ron Lanton, partner at Lanton Law, and today I have Shelley Bailey, founder and CEO of Famlee, spelled Famlee. What's going on, Shelley?
Good morning, Ron. Not much here. Just living the entrepreneur's dream.
And you know, the last time we talked was like 2014, and you were running a pharmacy back then, and now you're doing something completely different with Famlee. What's going on with that journey?
Yeah, absolutely. So in 2014, I was really involved in specialty pharmacy and advocacy and government affairs and all the things going on in the pharmacy world back then. But in 2018, we sold our specialty pharmacy, and I just thought I was going to focus on being a mother, and found out that I was having a little harder time getting pregnant than I had anticipated. So moving a few years forward now, I'm the CEO and founder of Famlee, and Famlee was founded on my own personal health struggles related to fertility.
So how long has that been?
We incorporated in December of 2020 and really went live serving our first corporate and direct-to-consumer clients in May of 2021.
Why don't you tell me a little bit about what you guys do?
Absolutely. Well, to start off with, I always tell people that like Famlee shouldn't exist at all. In a perfect world, gynecologists and OBGYNs would all have the time to do what we do, but they don't. So what we do is Famlee is the nation's first and only 50-state fertility telehealth and treatment company. So we combine the results from at-home labs with our clinical care and treatment protocols with someone's medical history that they've shared with us to really develop a personalized approach to care and treatment, so that when our customers meet with our telehealth providers, they're really getting comprehensive fertility care and treatment. Specifically, that means that most individuals end up with prescriptions for medications. So we write for mainly low-cost generic medications that help either support ovulation or help manage chronic diseases such as, insulin resistance and diabetes, thyroid conditions, and all sorts of whole body health issues that impact fertility.
That's why I like talking to you because, before, like I said, you were running the pharmacy, you're doing something really cool and something that I know is definitely needed in the market. So, when I see people like you and you're running different stuff, I always kind of like to learn, like, what did it take to get there? So, for people that are listening, what do you think it takes to be a successful entrepreneur?
I guess the first thing to be a successful entrepreneur is to recognize that you don't know everything, and that you really have to have a focus on and an interest on wanting to learn. I can say that when I exited from my previous career, I certainly came into Famlee thinking, gosh, I had a successful exit. I know how to run and manage a business. This should be no problem. I developed all my forecasts and just thought I was going to live life according to the forecast and the financial model I built, and found that that's really not the case. And so I guess in reflecting on that question, one of the other things is you really have to have grit. I think about that with my toddler and my newborn daughter and how I want to teach them about entrepreneurship. And I think grit is one of the most important key factors. So every day you just keep your head up and you just continue to plod along. And then I guess also being flexible. So with Famlee, originally had, different or the same concept, but delivering the care and treatment in a different way. And you have to be really flexible to, build a community of other mentors and entrepreneurs or business leaders, and kind of make sure you're listening so that you're willing to pivot and adjust based on the feedback that you receive. But for me, and kind of, I guess, how I run things, it would really be that grit, flexibility, and interest in learning, and a willingness to listen to others.
Yeah, it's funny when you were saying that, it reminds me of that Mike Tyson quote where everybody has a plan until they get punched in the mouth. And, as an entrepreneur, you definitely have to bob and weave and make some adjustments. So I hear you on that.
I feel like then that means I should be covered in bruises all day, because often each day seems like a punch in the mouth.
But you know what, you learn. That's the thing about it is, and to be successful, I think you got to learn from that. And if you don't have those bruises, that means you've made some adjustments and you learn something else. So I think
You
it's
know, I was reflecting on that with my husband, with family, and reflecting on the amount of investment it takes to start something new and scale. And, one of the things that he said, Shelley, every day you're paying to learn and get yourself all sorts of post-secondary education just by learning from your new business journey. So I guess you must consider it like the way of investing in yourself. If you don't learn it, you're just going to learn it later. So the faster you learn it, it'll really just help you throughout your career.
Yeah, I totally agree. Let me ask you this. When you were describing family, it sounds like a lot of tech. So my first question is, are you a disruptor?
Yeah, I believe that family is a disruptor. Right now, when people think of fertility, they automatically just think of IVF. It's kind of like when people want a napkin to blow their nose, they say, I need a Kleenex. And I think that kind of related to fertility, it's just people, especially women who are considered geriatric, such as myself, for pregnancy, they just think, gosh, I want to get pregnant, I want to have a baby, I'm automatically going to go to IVF. And here at Family, we are really supportive of IVF and know that it serves a really important role. But I do believe the disruption that we're offering in the marketplace is a seamless at-home solution to be able to provide that kind of first line fertility care and treatment to women. And, one of the holes in the market that we very early identified, and it really came from my background with HIV and Hep C, was that there's a lot of companies on the market that do testing. And I'm all about empowering people with testing, but there's not as many people offering treatment. And that goes not just for fertility, but other conditions where there's at-home labs. But when I reflected, it's not only unethical, but it's illegal to test someone for HIV and say, hey, you have HIV without providing care and treatment. Because 20 years ago, that would have been a death sentence. And I brought that perspective into fertility thinking, gosh, why are there all these at-home lab companies out there providing you lab results, which is empowering and is a good first step, but they're not linking the care and treatment. And so women who might receive labs that they don't feel, after looking at Google, are as optimal for fertility, they're really left alone in their journey, either doctor Googling or trying to convince their doctor to treat them based on those labs. So from my perspective, we are very much an disruptor in the market because we are linking that care and treatment piece in the fertility space at scale, which other companies to date haven't yet done.
Yeah, that reminds me of a conversation I had with a regulator in Vermont yesterday, and we were talking about healthcare costs that were rising. And I said, a lot of people are looking at, for opiates, for example, right? They're like, well, you need to get off of opiates. And it's like, well, you didn't ask that patient why they were on it. It might have been a job issue or, something financial. It might have been, a behavioral health issue, So it sounds like you're really getting into what's going on with that patient other than you need to have this, you know what I'm saying?
Yeah, absolutely. And we're trying to get away from just that prescriptive solution, like, hey, you're struggling to get pregnant, so we're just going to send you to IVF.
Yeah.
We very much partner with IVF, but our message, both direct to consumer, but also with employers, is we're looking at your female reproductive hormones, yes, of course, but we're also drilling down even deeper to see, do you have insulin resistance? Do you have thyroid problems? Do you have autoimmune markers? Because all of those things ultimately also end up impacting your reproductive hormones. And so it's can we get down to the more foundational level, figure out what's really going on so that we can test, but also test and treat you so that we can help support you through your fertility journey. But also you end up, getting help for insulin resistance or thyroid. I talk to many women each day, and it's a challenge because I'm a people pleaser. So I want every person to be pregnant working with us. And we had a gal the other day who was frustrated she wasn't pregnant yet. And I said, but did you know that you had diabetes? And did you know you had hypothyroidism? And her answer was no. And so my answer to her was, are you feeling better, getting care and treatment? And she said, yeah, I'm actually starting to feel better. And just this morning, she sent me an email that she's pregnant. So
Oh,
great story. So great story. but we actually are supporting people even beyond fertility, but even though our focus is on helping support fertility.
That's got to feel good.
Oh, I love getting pictures, ultrasound pictures, getting ultrasound videos. Someone's husband texted me the other day and said that he doesn't feel they have their daughter without working with Famlee. And the entrepreneur struggle is really lonely. It's very difficult, but when you're getting pictures of ultrasounds and videos and things, it's certainly what keeps me going.
Yeah, that's awesome. That really is. You really are changing people's lives, literally. That's cool. That's
We
really
feel like we are, that's for sure.
yeah. So technology, because you use a lot of that. And I know consumers, especially after the pandemic, when it comes to telehealth, things like that, are resorting a lot more to tech. And obviously, what you guys are doing involves a lot of tech. How do you see tech helping consumers in the near future with their health choices?
I mean, first of all, I guess from the perspective, and I thought you were going to take this a little more into like kind of because I didn't thoroughly answer your question last time about technology and family. But I mean, certainly to help consumers with their health choices, I think there's going to be a lot more AI involved in really trying to help consumers, with AI, integrate it to really figure out what type of solutions that customers need. But I think when we think about Famlee and we think about my own personal journey, we certainly consider ourselves a femtech company.
Mhm.
But I definitely, when you think about like a walk, crawl, run model, I went right for the run. Was we wanted to have our mobile app. We want to make everything as convenient for the customer as possible. And that's an important part. But I also feel right now in this space, it is just hot to have a fertility, anything in fertility and femtech's really hot right now. But even broader, it's just kind of hot to have a telehealth solution. But one of the things that gets lost, and we're starting to see this, I guess, even in the press this week in the behavioral health setting, is it's great to have a fancy app and be able to deliver care, via telehealth. But the service component is also critical. And I think for companies like Famlee or anyone who's doing this more long-term telehealth, it's really important to keep the eye on the prize, and that's really on the service. So that's going to be, I think, moving forward. Yes, there's a big technology component, but you have to integrate service. And luckily for me, with my previous background in specialty pharmacy, we were phenomenal on the service piece. So that's always what I'm focusing on at Famlee is, yes, we want to scale and be digital, but ultimately, how do we try to deliver that same care that a brick and mortar type of service provider would be offering?
Mm-hmm. I understand. Well, Shelley, it's lesson time. And I'm wondering, what lessons do you have for other women that are looking to start a business?
Gosh, I would say one of the first things related to starting a business would really be ask yourself, but then also, ask kind of your friends around you, have you identified something in the market that you believe you could either do better, faster, cheaper, or something that's really been, an unmet solution? So for example, with Famlee, we shouldn't exist at all. Primary, OBGYNs and gynecologists should be doing what we're doing, but they don't have the time in the traditional model. So someone like Famlee is here to fill in those holes. So as a female entrepreneur, I'd first really start asking, people in your circle about your idea, but also joining different entrepreneur networks and really starting to ask, like we talk about technology, or let's say we talk about legal, and really not just operating in your own little island, but asking other entrepreneurs, hey, what's average to pay for legal services? What's average for tech services? What do you pay for design? How do you procure contractors? Trying to learn from others' mistakes, I think, is an important piece of entrepreneurship. And I think for women entrepreneurs, especially, it's like join some of these female groups so that you can help support each other, but also learn from others' mistakes.
Yeah.
And then this goes for all entrepreneurs, not just female entrepreneurs, but I'm a big fan of Donald Miller and his kind of story branding concept. But they always say that like cash is the fuel to your airplane. So always be mindful of your cash. That's something through my own journey that I've been struggling with. You see the needs of the company, and then you also watch your cash reserves. But that's an important piece that people lose track of, especially once they've got that first round of funding. I think that's the time where you feel like you can breathe, and without cash, you can't keep your plane in the air.
Yeah, that's for sure. Well, last question here has to do about advocacy. And I know when I taught you back in 2014, you were very involved in pharmacy policy in the state of Oregon, where you're at. How has advocacy played a part in your career? And you can answer that either way. If you want to go back to the pharmacy, great. Or if you want to talk about what you're doing at Family right now, or maybe how you see that playing a part in that.
Yeah, I guess I can speak to both. I mean, I think I was very lucky really early on in my career to see, and observe how you really can change, the outcomes, not only, I guess, for your business, but more importantly, for the community at large through advocacy. Advocacy works in, gosh, I guess it was 2014 that we last chatted, but I was involved in some advocacy efforts, even I think in 2012, that are now laws in Oregon that are, very consumer friendly to Oregonians, but also then helpful to pharmacies. And now with Family, I feel like there's even more of an important role with advocacy, because right now only 19 states have any type of law related to fertility services being covered. And so I definitely see the role for Family and, kind of customers in our ecosystem and working with other business partners is really focusing on, strengthening the laws in the states that already have them, but then also really kind of having the rubber hit the road and doing that grassroots advocacy state by state in the states that don't have any sort of laws on the books related to fertility care. But I think for the average, individual or the average business owner, we often have so many other competing interests for our time that we just kind of think, oh, I can't be involved in policy, or one person's not really going to change the trajectory of anything. But I can say that, like, I've witnessed firsthand, specifically in the pharmacy space and with HIV and hepatitis C, that one person's voice does matter. And you really can change things. So advocacy is going to be a huge part of what myself and my team focus on at Family moving forward. And that's really through also collaboration with others in the space.
So, last question for you. How do listeners get a hold of you if they want to find out more about Family or questions about advocacy, or they're maybe planning a trip to Oregon?
Well, absolutely. So listeners here that are interested in Family can go to famlee.com. That's F as in Frank, AMLEE.com. Anyone who specifically has an interest in getting fertility care and treatment can also go to famlee.com/appointment. We offer free 15-minute appointments for individuals to see if Family is a good fit for you. I can be reached at Shelley, Shelley, at famlee.com. And I welcome talking to other entrepreneurs, working with others who are currently in the fertility space, as well as also directly working with women and families who are struggling with fertility issues themselves.
Sounds good. Well, I definitely have to take a trip out to Portland. One, to see you, and two, to try some of the food out there, because I know it's real good. And
Definitely.
so that's good. So I'm glad everybody's got your contact information. It was great having you on. Once again, Shelley Bailey, CEO and founder of Famlee, Famlee, clinical fertility treatment at home. And you are definitely going to have to come back on the show, because I know you're working on some other projects, and we'd love to have you back.
Absolutely. I appreciate your time, Ron.